Okay, it is live on YouTube.
Okay, so the stream is up. You should be able to see the just the title card, but okay, so the stream is up. You should be able to see the and a delay, just the title card.
Yeah, so if you can mute one of those things.
Yeah. That sounds like me.
And I will go ahead and let people in 2 minutes. And I'll start the recording once we start the meeting at 1.
George, do you have a screen open that shows the YouTube screen?
I don't.
Okay. It looks like it's kind of flickering. I'm looking at it on a second monitor. Let me see on another computer. Maybe it's just the VPN.
Looks okay to me.
Okay, it's probably just my connection. Trying to see everything all at once. Okay, yeah, it looks fine. I looked at it on my regular computer. It's just my little docking station stuff.
Hey, Nick. Okay, I'm going to go ahead and admit everybody.
Okay.
Hi, Rick.
George, how are you?
I'm well, thanks. How are you doing?
I'm doing good. So you can hear me. This is good. I just got the camera installed on my desktop, so this is the first time I'm using it.
Looks good.
One of our meetings. So yes, I think it's okay.
Hi.
George, I'm going to mute my machine, but I'll be here if you need me.
Same
Great.
here.
Thank you, Craig.
Same from Karen.
Okay, folks, I'm going to start the recording now, just so you know. We're also live on YouTube. So if you want to just identify yourself, then I can change your name so we know who people are. So Rick, I've got. Who else is with us?
Lori's here.
Okay.
Karen Darner's here. D is in David.
Yeah.
Yes.
Hang on. Lori, can you just say hi again?
Hi. I
Okay, I think
unmuted.
that's right.
Can you hear me?
Yep.
Okay.
Okay, so who is 804-662? Oh, no, that's one of ours. So Karen Darner, if you can just say hi.
Hi.
I see you. Okay. Yeah, okay. I'm going to rename you. Okay. Is Carter here?
I'm expecting him. We did have a conversation last week about this meeting, so I'm expecting Carter.
Okay. Is Karen Garner here?
Karen with a D is here. I haven't
Yeah.
heard from Karen. Oh, I couldn't tell what you said, so.
Oh, sorry. Yeah, Karen Garner with a G. And I know Laura Bowser's unfortunately unable to be with us today. So we're just waiting on Carter.
Okay.
Karen Garner has been moving, so I think they may be finished but getting to the place, but I'm sure
There's
not.
Lori.
There, we see you, Lori.
Yes.
Oh, sorry. Here's Carter. Carter's in the waiting room. I didn't. Okay. So Carter should be with us in a second.
Oh, good. Okay.
Great. All right, Rick, if you'd like to go ahead and actually, if I'll just run through the YouTube, sorry, I'll run through the Zoom controls, just everybody's on the same page. So this is the Legislative Committee meeting for the Alzheimer's Disease and Related Disorders Commission. For Zoom, just you have your controls down at the bottom. Please keep yourself muted unless you're talking. You can use the space bar, hold it down while you're speaking and we'll be able to hear you. Please keep your video on so we can see you. Use the chat to let us know of any technical issues, but if you have anything related to the meeting to say, please say it in the meeting. Don't use the chat for that. And then you can use the reactions if you'd like. That's a thumbs up and a clapping hands. And that's it. So I'll turn the meeting over to Rick and put the agenda up.
Thank you. Thank you, George. And I'd like to welcome everyone and thank you for coming today to take part of your time from your valuable day to go through this. We typically have these meetings once a year, so they're obviously very important. You see the agenda in front of you, and if you had a chance to look at the agenda before the meeting, and if you scroll down you can see a line that says for materials, click on that link. And when you do, you'll see the meetings from the minutes from the last meeting, which was May 9 of last year. So that's where those were, in case you had not seen them, and I had to look for them myself this morning. So as a place to start, if you have already looked at those minutes, good. If not, take a minute to look at them. They are very important because what they are is a description of what our suggestions was to the legislature for last year. So you can see.
So here, I'm putting them up on the screen now, Rick.
Yes. So there are the meeting minutes from last year, May 1, 2019. And if you look at them, you'll see that there was discussion of the Bold Infrastructure Act. There was the ongoing, really important issue for us, funding for dementia case management. There was the issue of the sunset of the commission, which obviously we were not sunsetted. We remain in existence. So those were the recommendations from last year. So as a matter of course, if we could get a motion to accept those minutes from last year.
I'll make a motion to accept the minutes of the May meeting, May 19, 2019 meeting.
I'll second.
2019.
Thank you. All in favor of accepting those minutes from May 19, say aye.
Aye.
Any opposed? Showing none, then George will accept those minutes. You'll also notice on the agenda that there was an opportunity given for anyone who wants to join us for public comment. Is there anyone on, George?
So any public comment would have had to be submitted in writing or by phone prior to the meeting, and I did not receive any.
Did not receive any. Okay. We typically have to give opportunity for that so that any citizen who would so desire can make comments or give input. Then there are none. So we're going to move on to why we're really here, which is discussion of the legislative platform items. I believe that many of you got access to what the Alzheimer's Association has put out. Came out in May of this year. And Carter, are you on?
Yes, Rick.
Would you like to, for the purposes of the committee, discuss this document and what the Alzheimer's Association would be suggesting to us?
Sure. So as you all are aware, the issues around COVID-19 and nursing facilities have been honestly pretty devastating to those populations. And we have a lot of people with Alzheimer's disease that reside in these nursing facilities. So our association has put together a series of recommendations to help make sure that we are providing the resources, we being the state, are providing the resources that are necessary for these facilities to fight COVID-19 to the best of their ability. And if you've seen the document, it sort of breaks down into three categories. The first category revolves around testing. And some of these things in Virginia we've been able to accomplish, but I'm going to go through them all just so everybody knows what they are. Establishing a protocol to use testing to verify as a baseline that the facility is infection-free. And in Virginia, we've been doing point surveillance to accomplish this in both nursing facilities and assisted living facilities. So I think we've made good progress on that. And then once we have the initial testing, there would be ongoing testing, which again is currently the guidance from CMS, and it's based on how your percent positive level in your locality at the time. And then of course, the rapid testing, I think you all might have seen that the governor is a part of a collaborative to get 500,000 rapid tests. We'd like to make sure that those are available to facilities so that they can be utilized. And we can also utilize some of those for screening for individuals that are coming to do visitation for nursing facilities and ensure that we don't accidentally spread COVID-19 into facilities while doing visitation. The second category deals with reporting. And if you recall at the beginning of this pandemic, the governor's office was not reporting information based on where type of facility that outbreaks were occurring. And the governor cited some state law around that issue. Since they decided that they could, in fact, report these information to the public. And so there is currently, that's currently being done through the Department of Health. Additionally, there is some legislation in the special session that addresses this reporting requirement. So I think a lot of these areas are moving forward. The third criteria deals with surge activation. So when we have a hotspot, if you will, of COVID-19 in facilities, it's about how we respond to that and making sure that we get the resources in. Additionally, it's also about making sure that we have the long-term care ombudsman having access to facilities and make sure that we have PPE for those folks. So that's sort of the third item. And then the fourth item is basically supporting the facilities. And that involves making sure that we have PPE to facilities, that we're making sure they get information about how to take care of folks with Alzheimer's disease in this circumstance, because there might be some unique pieces to that. And also just sort of generally making sure that they are supported, the facilities are supported with what they need. So those are the four items that I was hoping to bring to your attention. And what I would like the commission to support is a distilled version of this, where we basically make a sentence out of each of the major bullet points that are the four primary bullet points to ensure that we are moving these issues forward. It's difficult to predict what an exact piece of legislation might be around this, because some of this landscape is changing with the special session. But I think if we have a broad, essentially paragraph that covers these issues, it should provide us with the opportunity to become involved in a number of areas around ensuring that we address COVID-19 in long-term care settings. And I'd be happy to answer any questions, Rick.
So George and Carter, let me ask this question. And in the daily press today, there was news of a vaccine and stage 3 trials AstraZeneca is doing that may be ready for submission to the FDA by the end of the year, and could even be, we could have vaccines in early new year. And in that same article was a discussion of prioritization of who would receive those vaccines. And you'll be happy to know that they talked about essential staff, and they also talked about individuals in nursing homes, assisted living facilities. So my question to you is, do we need to say anything about that? Is that anything we should even think about in our comments to the legislature?
Well, for my part, Rick, I do think it is something we should think about. And I do think it's something that is important. I know there have been discussions within the long-term care, the governor's long-term care task force, very preliminarily, about how this type of, once the vaccine's available, how it will be distributed. So I do think it's important to highlight that. And I think it would fit well within these four items. We could make a fifth sentence or what have you that would cover that area.
Yeah, the article talked about, and this will surprise no one, assuming everything goes well and it gets through FDA and it's safe and it's effective and we begin distributing them early in the new year, there would be a very limited number of vaccines. And so the prioritization of who would receive them is obviously very, very important. And the article I saw, I was in full agreement with how they prioritized it. So I just wanted to bring that up as something we may want to make a statement about, because it did put nurses and doctors and people in long-term care facilities at the very top of the list. Yeah.
I agree. This is Karen Darner. I think this is a very important thing. And the aspect of prioritization needs to be, that word or something like it needs to be there just to reinforce the fact that the long-term care facilities should be considered priorities.
Yes.
Yeah, Lori here. That's been pretty widely reported for the last couple of days from a number of sources. I agree that we should include it, but it's been pretty consistent across a number of sources, the prioritization strategy. And so it's very encouraging. And I know there's just so much that we can accomplish in the way of a platform item. But I also feel as a advocate for community-based care, you know, for every person in a nursing home, there's still 3 in the community that are equally impaired. And although I had retired again from Circle Center right before the pandemic struck, I heard a lot from staff at our center, and I'm sure we were representative of the major challenges to families who had people in robust community care programs who lost adult day, they lost their in-home companions, and many people, caregivers and the participant or client or patient, whatever you call them in community-based settings, although they didn't have the risk of being in congregate care, they were often in multi-generational households or with an equally at-risk caregiver. And so I don't want us to have the broader community think that nursing homes are the only place that we find people who are at so much added risk because of the pandemic. And so I don't know what your thoughts are on whether we can sort of raise that issue up, not to compromise the Alzheimer's Association's recommendations. They're certainly sound, valid, necessary. The other problem is, of course, the community-based care challenge is even more daunting because people are spread all over the community. We often don't even know where they are, but for us not to forget that somehow. I think the priority that I saw, although I don't have it in front of me, did pay a fair amount of attention to other at-risk seniors. I mean, people in facilities were highest, but following pretty soon after that were other high-risk seniors. Or high-risk adults, I should say, because many of the people that we're concerned about in the dementia community may be in their 40s or 50s. But anyway, just for us to not lose, get too focused and not lose sight of what's happening out there in private homes with all of this.
I saw the same language, Lori, that although it certainly addressed facility-based care, nursing homes, assisted living, et cetera, it did have, the article I saw did mention community-based seniors. And so Carter and the rest of the group, I think whatever language we eventually come up with, it would be easy to say that we care about the community as well.
Right. Yeah.
Absolutely.
Right.
Yeah.
I agree. We have to figure almost 60% of the deaths have occurred in these long-term care facilities.
Absolutely.
And
right.
What I worry about, and we may be able to cover it in another place, but I don't want the fact that there's been so much loss there to be lost. And so we have to figure out a way and it may, like I said, we may need to do a separate piece for it, but I think I want to make sure that because of the just sheer numbers of loss here, that people aren't losing focus on that.
Yeah, and that's why I started out in the beginning saying doing nothing to detract from the importance of the people in residential settings, to be careful that we don't, lose sight of the others. So I'm fully in support. I've just gotten a low bat message, so I'm going to leave the screen for a minute, run and get my plug. I'll be right back.
So as we talk through this, I think we all can agree on the points that Carter has brought to us on the Alzheimer's document, and that we also consider making a statement about distribution of vaccines once approved, to focus on community-based care and obviously as well as facility-based care. Carter, let me ask you this question. Last week, you and I spoke about statewide dementia care management. Do you want that to be in there as well, or is this overkill?
No, I definitely want that to be in there. So I was thinking that this item here that we're talking about for COVID-19 will turn into one bullet point, for lack of a better way to describe it.
Okay.
And then dementia specific case management would be a second bullet point, or i.e. our second recommendation, because we did get that in the conference report last year, only to lose it in the COVID-19 cuts. Now, there's still a slim chance that it could be restored in the special session. But honestly, at this point, I think targeting the next legislative session with the same ask we had last year is going to be our best bet. So I definitely would see those as two bullet points. And there may be a way to write a third bullet point, if you will, if you think about our traditional style, around some community-based response to COVID-19. And that may cover the point that Lori was making, and that would give us 3 items. Not that there's any magic number to 3, but
Yep.
True. I think I have said, and I think that the short courses or the 1-hour programs that they've had that have been given to us from the governor's aging conference, talking about isolation and the fact that immediately everybody went to isolation of nursing homes, long-term care, and other and hospitals, for instance, and that there was no contact that was allowed to be given, that you couldn't have visitors and so on. And that as a result, there was significant difficulty for people who were either diagnosed with Alzheimer's or a form of dementia, but also those who were very cognizant of of being kept from their families, and vice versa. And I think that might be the third one. So that goes into the discussion, almost a study that needs to be pulling together all the affected groups, including the medical community and the medical professionals who are working with the folks in nursing homes and long-term care, to decide how best to do this and to do it before there is another emergency situation or a pandemic. I think we're seeing now hospitals and some nursing homes are providing situations where people can be visited by their families, maximum of 2 at a time, and for only a certain number of days per week. And so keeping that in mind, I think that's something that we really need to pull all together all the issues that we had with regard to the regulations that were all of a sudden manufactured and applied, but not really with reality involved. And you were trying to safeguard everybody, and as a result, the concept of the isolation and the effects of it were felt everywhere. And that's going to be an important process that's going to take some time, and it's going to take lots of different groups pulled together. And each state may do it, but I'm not sure about that. But whether they do or not, we need to at least mention it, because I know that that's going to be an issue for lots of different groups to do. And you could cover you could cover the vaccines, you could cover visitation, and the care and management of folks in that discussion that's done in a study like that.
Hey, Karen, I've got some thoughts. George, if you would move the vaccine distribution up to platform item 1, it would go in with that, and based on what we're talking about. But Karen, I think generally speaking, there is a bill that has passed the House and the Senate in the special session related to visitation, and it's going to require some emergency regulations to implement. And I think what you're talking about will occur as a result of that piece of legislation. I think highlighting some of those needs would be a good idea. I think we had to figure out how we would do that. But I do think that's something that is going to be really relevant here in the next couple of weeks.
I agree. And it did concern me when they passed something along the lines of a bill versus a study, because again, it's being done. Well, I don't know if definitions are included in the bill, but it seems to me that there's got to be together, people have to be thinking about it and bringing something forward without just the fact that it was a very difficult and quick decision to do such a thing, and lots of people suffered as a result of it. And so that again, having the legislation as a bill says it will be done and there will be exceptions, there will be an emergency, blah, 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 blah. But you really need to have everybody who is a player in the situation together to make that decision and try to get some of the things ironed out before the pandemic comes again, and then all of a sudden we're doing an emergency again. So, but that's just my feeling. But I don't want it to be something that's cast in stone like legislation can be before we've had everybody voice their concerns about it.
Yeah, and I don't know if you've read the bill or not, but the bill sets up a pretty broad basis of and then requires regulations to be drafted as a result. So it sends you through the APA process.
Okay, good. So they'll have to get together anyway. So
yeah, that process is of course not perfect by any means, but it does set up, it does allow for public input. It does allow for the stakeholder meetings and that kind of thing. Good. So, but that being said, I certainly think it should be highlighted. Because I think, like I said, that process is going to move probably pretty fast as the state moves forward. It's complicated because there are CMS guidance and there's CDC guidance,
right?
And, and then that changes from time to time or perhaps regularly, and makes it even more complicated. So
thank you. Yeah, I understand that. I did have one more thing. It was either yesterday or today, talking about the governor's request to increase the subsidy to the nursing homes, $20 a day along the Medicaid patients. That would allow for that to be an increase, especially when there is a pandemic situation occurring, and it would take effect immediately for people relying heavily on the Medicaid. And so it's, I think his request, or maybe what he's bringing to the legislature now, is that it would be in effect through next summer. And so that you really do have a conclusion, hopefully a conclusion to all of this. And I'm not sure, since I haven't seen the writing of the proposal that he has, but it's a concern that it doesn't mean this summer or next summer, but it's that kind of reassurance that we need to make sure is there.
So as an attendee for the long-term care task force, I've seen those recommendations, and they do extend out for nursing homes and assisted living facilities. There's different dollar amounts. They extend out for the life of the CARES Act, which is what that funding is coming from. So I think it's extended for as long as is reasonably possible in the way that Virginia does its budgeting. So,
well, I know that he was saying summer, and that I wasn't sure which summer, so that's fine.
yeah, I feel reasonably confident that that's covered through the rest of the fiscal year.
Right. Okay.
And of course, as you know, when Congress reconvenes this week, the Republicans and Democrats are going to have to reconsider an extension of all kinds of benefits. And I'm sure we're all following it in the paper, and I have no idea where it's going, but hopefully there'll be some progress made early in September for a continuation of some of those benefits that we saw end. Yeah.
Right.
So let me ask a procedural question, George, and I'm probably throwing a little wrinkle in this. So feel free to tell me if you think I have. So as we were preparing for this meeting today, I reached out to Bill Massey, the CEO of PAA, and I also reached out to the Riverside Health System, and I sent them a copy of what Carter provided us with Carter's permission to give them a chance to review it and make comment to us.
Mm-hmm.
They said they were interested in that. They've scheduled a call with me on the 10th of September. But I noticed that one of the things that we were looking at today was whether or not we were in fact going to approve recommendations today. So it could be that we wouldn't have time for me to hear comments from Bill Massey or Riverside. Thoughts, folks?
So the issue here, Rick, is that we have a hard deadline of October 1st for the annual report of the commission to be presented to the General Assembly, the governor, and the Doris Commissioner. And the full commission needs to vote on that annual report. And of course, as you know, the full commission is meeting next Tuesday.
Got it.
So we would need to have another extraordinary meeting later in the month to approve that if we were going to delay that.
Well, and Carter and I spoke about this too. And so it's unusual, and I don't know that we've done it before. And so perhaps I get back in touch with them and advise them of the deadlines that we have in front of us, and tell them that I'm just not going to be able to take their comments this time. So I'm perfectly willing to do that. The other thing Carter and I talked about is, even though we want to hear what the AAAs say, whether it's Bill Massey or anyone else, they serve a population that isn't just about Alzheimer's. And of course, our focus on this commission is about Alzheimer's. So the AAAs have their way of getting their thoughts in front of the legislature without coming through us. So that could have been overkill. So in that regard, I apologize.
No need to apologize. But yes, so there's representation on the Commonwealth Council of Aging. So and they will have their own legislative agenda. So
okay. So let me ask this question. Go ahead.
Rick, just to let you know, I also serve on the Commonwealth Council on Aging, and I also serve on the legislative committee for the Commonwealth Council on Aging. And so I do think there are issues there that are aligned with the AAAs, if that's a concern. The other thing I would offer is, obviously we're going to approve this in a draft form for the full commission. If folks had things that were And you're probably going to have to empower George and I to sort of massage these things into something that y'all will look at later. But if they have serious concerns that then they can sort of give it to us right, up to the day of the commission's meeting, and we can tweak language if necessary.
Okay.
In writing.
Yes.
In writing, yeah.
So that brings me to my next question then. So today is the 1st and the meeting's on the 8th. So apparently, Carter, you and George are going to take notes from our meeting today, and you're going to edit and refine this, and you're going to present it on the 8th, and we're going to vote on the 8th. Is that what's going to happen? Okay.
Yes, that's the idea.
Okay.
That's the plan.
But in the interim, I think it would be appropriate for this subcommittee to, endorse whatever it is they want, from a big picture perspective,
Okay.
us to do.
Yes.
Very good. All right. So is there more discussion then from the committee about what you see in front of you that George has given us about what the platform items are and what some of the 20,000 foot language would be? Are there questions, concerns, other ideas?
Rick, there's only one last thing that I didn't think about, or when we had our conversation, and that might be bold.
Yes.
If the bold grant is awarded to Virginia, then there may be some things we want to do. I'm not certain that we can have this in the platform per se, but maybe there's a way to reference at least the public health component, perhaps on item 3. I mean, we can have it from a public health lens so that at least it ties into bold generically. And that may give us some leverage there. I'm curious what the committee thinks about that.
Well, I think that's great because it's in keeping with what we said last year. And I really like the fact that we're continuing to talk about what we spoke about last year to include the care management. I don't want those things to go away. I want us to keep talking about them. So that makes perfect sense to me. George, I wanted to ask you a question. Is there any point in referencing the NIA grant that UVA is applying for?
I'm not sure that this is the best location for that. I can certainly put that in the annual report. So in the broader language of the annual
Yes.
report, but I'm not sure that it needs to go into these platform items.
Okay. Okay. So Lori, Karen, other thoughts, comments about what we have in front of us? Concerns?
No, I think most of this has gone right along with what I was thinking to supplement anything we carried over from years.
Would it be appropriate to this time then for me to ask for a motion to approve this broad language as our legislative recommendations moving into September 8th?
I so move.
I'll second it.
Any other discussion before the vote? So all those in favor of submitting this language as will be edited and refined by Carter and George to the commission on September 8th, please say aye.
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 Aye. And any opposed? Hearing none, I think we have what we need then. Other things for the good of the group? Okay, if not, I'm going to adjourn the meeting. And we look forward to talking to you on the 8th.
Terrific. Thank you.
Thank you, Rick.
See you
Thank
all
you.
later.
Thank you,
Take
Rick.
care. All righty.
Thanks. Bye-bye.
Bye-bye.
All right. you want me to go ahead and stop the YouTube?
Yes, please.